The length of stay following joint replacement has significantly reduced over the years. Many of my patients will go home the same day following joint replacement surgery. Otherwise, the majority will go the following day. Either way, the criteria for discharge depend on patients being medically well, safe on their feet, and their pain being well controlled. Rehabilitation following joint replacement surgery starts as soon as possible. Once the anesthesia has worn off, the nurse will often get the patient sitting up on the edge of the bed and walking a few steps with an assisted device. Physical therapy will follow soon after to get patients up and walking, including stair use, so that they can go home, especially if they're going home the same day. This can then transition to physical therapy in the house, in the majority of patients, but also outpatient physical therapy. The pain levels following joint replacement surgery depend on the patient and type of surgery. The deep-seated pain from the osteoarthritis is resolved as the joint is removed. The soft tissue pain from the incision gets better very quickly within 2 to 3 days. Either way, we employ a multimodal pain strategy to help combat the pain. This involves local anesthetics, nerve blocks, medications, including cautious use of opioids, as well as ice. Day by day, pain symptoms improve such that patients can exercise, sleep, and mobilize better. This depends on the patient, the disease severity, and baseline function of the patient, including walking aid use. In general, after joint replacement surgery, walking aids are required for all patients. For hip replacement surgery, walking aids are required for somewhere between 2 and 4 weeks following surgery. For knee replacements, it's a bit longer, between 4 and 6 weeks following surgery. We encourage regular activities as soon as possible following surgery, especially activities of daily living, usually as pain allows. With time, we can allow showering, which can be done early on as long as water does not get under the dressing. Soaking in the bath and using a swimming pool is deferred for at least 6 weeks to minimize the risk of infection. Driving is deferred for around 4 to 6 weeks, and this relates to the ability to use the brake pedals, and especially if surgery is performed on the right-hand side. Range of motion restrictions can be there for hip replacements for around 6 weeks following surgery, and this is guided by physical therapy. Finally, sports and especially contact sports are deferred for about 3 months following joint replacement surgery. Following joint replacement surgery, we have no weight-bearing restrictions, and one can mobilize weight-bearing as tolerated with an assisted device. Pain is a good guide to how much to mobilize, and activity levels can be modified according to pain levels. Swelling is an important problem after joint replacement surgery, and this can be combated with ice, elevation, and early mobilization, as well as minimizing time spent standing up and hanging the leg over a bed as well as over a chair. There may be range of motion restrictions, especially with joint replacement surgery and hip replacement surgery in particular, and the physical therapist can reinforce this. Recovery can be slowed down by a few things. Firstly, pain that is uncontrolled or worsening day by day can be addressed with taking things easy after joint replacement surgery, mobilizing according to pain levels, and modifying activities is important. As part of this, we employ a multimodal pain regime to help combat pain with the use of local anesthetics, nerve blocks, analgesics, and anti-inflammatories, as well as the use of ice. Swelling can be a challenge to help hinder rehabilitation too, and the use of elevation as well as ice again and early mobilization can help recovery. Finally, the use of physical therapy prior to joint replacement surgery or prehabilitation has been shown to improve postoperative recovery and rehabilitation, so I employ that in all of my patients. The The main things to look out for following joint replacement surgery are pain that is worsening day by day. Importantly, there should be no significant fluid drainage from the surgical incision site, and the body must be monitored for any redness, fevers, or chills. I recommend regular follow-up following joint replacement surgery in the office. This enables time to monitor progress, address any concerns such as complications or the need for treatment early, as well as answer questions and maintain pain control levels, as well as optimizing and adjusting rehabilitation. Obviously, if the need arises, then follow-up can be increased in between the scheduled intervals. At present, our scheduled intervals are around 2 to 3 weeks following surgery, then 6 weeks, 4 months, and 1 year. Beyond that, surveillance is lifelong for a joint replacement. Preparation for joint replacement surgery begins well in advance of the surgical date. This begins with physical therapy to serve as prehabilitation to help train for recovery and rehabilitation. Prior to going home, patients will often clear the use of stairs so that they can be safe in their own home. It is useful to have someone to take patients home with them and ideally stay with them for a few days if that option is available. Physical therapy is arranged in the majority of patients in their home for the first few days to weeks and then transitioning to outpatient.